see, movies to not to see. Good morning, everybody, and I'd like to say thank you very much again to everybody at the Advocacy group for inviting me to give this talk to you all today. I'm here to talk about MPN Voice, which is the organisation in the UK. I am the administrator of MPN Voice, and I am also an ET patient, and that is how I became involved. Who are we and how did we start? Well, MPN Voice started in 2003 when several patients with MPNs got together under the guidance of Professor Claire Harrison, who's going to be here later today, with some specialist nurses, one of whom was Yvonne Francis, who we saw yesterday, and some other haematologists and psychologists in St Thomas's Hospital in London. And their goal and their aim was to create a place where people with MPNs and just MPNs could meet each other and discover that they weren't alone, because it can be very lonely having an MPN, especially all those years ago when there wasn't a lot of information around. So they wanted a place where people could find information that was both accurate and empowering. And they formed what was then called MPD Support, because MPNs used to be MPDs. In 2011, we became MPD Voice because we wanted to give people a voice. And then in 2013, we became MPN Voice, changing to MPN because of the World Health Organization reclassification. So to provide this information and support to people with MPNs, they started a website, and very, very luckily with a grant specifically from Novartis, they were able to do that. And it was covering all aspects of MPNs. So details about what each MPN is, what they are, how they are diagnosed, how they are treated, information about medications, symptoms, how to manage them, drug trials and findings, new advances, and about print. And we also had printed information booklets and much more. So from having this website, the team then were able to encourage membership to the organisation, to MPD Support, and to then expand on the information that they were providing by listening to what people with MPNs wanted to know, what support they needed, and how they wanted to receive this support and information. So membership, well, we grew from just those few people sitting around the table, and John, I don't think there were very many of you, were there? A few, 7 of you. I wasn't there right from the beginning. As of today, we have 2,994 people registered with us. So we need a few more to get to beyond 3,000. So can someone join, please? Anyone? And they don't just live in the UK. We support people across the world. So just want to make that clear. Wherever you live, we will support you. You can become part of us. We will love you. And they are mostly MPN patients, but they also include family members and carers, haematologists and nurses, and other representatives from other patient organisations. So, we've got quite a broad membership. And as I say, if you do want to join us, please do. It's free. Just have to send me an email. Our legal status. We are registered as a charity. And we are very, very fortunate, and we do know this. We are registered under the Guy's and St Thomas's charity in London. And they administer on our behalf all our legal and financial aspects of being a charity, as well as all the legal aspects of being a patient organisation, offering support and information and handling the data that we collect and use in accordance with all the appropriate data protection regulations in the UK, EU, and the rest of the world. So we are very, very fortunate in being part of such an amazing organisation as Guy's and St Thomas's, and we know that we are very lucky to have their backing and their support, which is absolutely immense for us. How are we managed? Well, I'm in charge. We are managed by a steering committee, and that's made up of 4 haematologists, one of whom is Claire, 2 specialist nurses, as I said, one is Yvonne, and 11 MPN patients, and a trust manager from Guy's and St Thomas's. We've got 18 people, and John is our chairman, so he thinks he's the boss. And I... No, you don't. And I am the administrator, or as I like to call myself, the dog's body. But I quite like being the dog's body. So as the administrator, I'm responsible for the day-to-day running of MPN Voice. So that is including updating and maintaining the website, monitoring our online forum at Health Unlocked, all administration, which includes registering and welcoming new members, organising regional patients forums with other members of the steering committee, and much more. I talk to people via email or phone, and lots of other stuff. Other members of the steering committee are also responsible for various roles, which includes fundraising, editing and producing the information booklets and our newsletters, financial accounts, and helping at lots of our events like our patients forums. And apart from myself, all of the members of the steering committee are volunteers, but they actually do very kindly pay me to do the job, which is very nice. But everybody else is a volunteer, and they do give a lot of time. And bearing in mind that they have jobs in the day and they have an MPN, they are fantastic, and without them, we really couldn't keep going. So it's very, very good. And how are we funded? Well, we're funded mainly by people who are very, very generous in donating money to us in various ways to support us, and also by people fundraising. We've got a fantastic group of people that belong to MPN Voice and regularly support us with so many varied fundraising events. How people think some of them up is beyond me, but they are amazing, and they do have a lot of fun, and we stress fun in the fundraising when we encourage people to take part in various events throughout the year. And we've also have received grants from various pharma companies and charitable trusts. So we have been very fortunate throughout the years that we've been able to build on that and keep us running and keep us growing. So it is a great thing if you can encourage people to fundraise for you, to get involved, to make them feel part of their organisation, that they are helping to keep it running. It is their organisation. We are there to support the people with MPNs. So get them involved in all of that. And our success factors. Well, since we started in 2003, we have become an established organisation within the MPN community, and we have grown in the terms of the information and support that we offer to people and to provide to people, not just in the UK, as I said, across the world. And, the amount of people that have joined us and turn up to our forums, it shows that we are doing something right. We don't always get everything right, but we're obviously doing something right. One of our main successes, I feel, are the regional patients forums that we hold around the year. The first one, I think, was way back in 2005 in London, and there weren't many people there, were there, John? About 8 people, yeah. So from 8 people in 2005, we held 9 around the UK and in Ireland last year, with 883 people coming along, so a bit of a difference. We've had 6 so far this year. We've got 3 more to go, and also our Living with MPN's days, our international days that we hold every other year. We've got one coming up in November in London. We're very proud of those, and they are growing every year. And the patients' forums, they're not just for people affected by MPNs to come along and hear the latest news about trials, medications, and to meet other people, to share hints and tips and support each other. They're also to meet haematology consultants and specialist nurses, and it's in a relaxed and informal environment, so it's a really good way for people to be able to speak to haematologists in a different setting to the consulting room. And the feedback we've had from the haematologists, particularly when they first started, was that they found the experience changed the way that they were then seeing their patients in their consulting rooms, because they had a better idea of the knowledge that us MPN patients have and what we want to know and how we want to be treated, that we don't just want, oh, how are you, Mr. Smith? Here's your prescription, thank you. You know, we want to engage, we know about our MPN. So the forums work both ways. And importantly, we do welcome family members and carers to come along, because they need support and information the same as us, the patient. And that is very, very important that we encompass the family members and the carers and make them feel important and empower them to carry on this journey with us MPNers, because you know it can be difficult living with somebody with an MPN. I know, I've got one, and my husband tells me frequently it can be difficult. I don't get it really. So yeah, we do. It's an MPN family. It's everybody. So that we're quite proud of that. I'm very proud of it. So if you want to start an organisation or you're just starting, I think what you need to consider is what type of information do you want to provide, and how are you going to provide it? You can have a website that can be quite expensive. So you might need to pull in some favours. You might know somebody that is a web developer and can do it for you. You know, do you want to provide support by telephone contact, email, or online forums, or face-to-face meetings, the forums like we have? And who's going to administer that and monitor it and develop it? Who's going to be sort of overseeing, you know, if you're having a telephone line, do you need somebody medically trained on the other end, or is it just a patient, and specifically detailing that it is just another patient that somebody is talking to, they're not getting medical advice? Do consider that. And can you get support from any doctors and nurses that can come into your community, be part of your organisation, that can answer then any of the medical questions you get? Again, we're very fortunate that we've got Claire Harrison, we've got Yvonne Francis, and we've got other consultants on our steering committee, so that we do have quite a wide network that I can tap into to get support and information and answers to queries that I get. So we've always got somebody that can answer a question. So it's either one of us as an MPN patient or one of the medical professionals. Funding, it's very difficult. Funding issues, as you say, in different parts of the world, it's difficult. Some countries, it's not natural to go out shaking a tin and asking people for money and doing fundraising events. We're lucky in the UK, it's a kind of thing that we do. You know, it's part of our culture, so we're very lucky. And as I said, we do get people engaged in having fun in raising money for us. So we are very, very lucky, but you do have to think about that. And, you know, running costs of your organisation, are your team members going to be volunteers? Should you pay them? Can you pay them? That's an awful lot, you know, to think about. That's something you maybe grow into as you go. The legal aspects of running an organisation, who can advise you, you know, on all the different legal aspects, you know, regarding data protection, charitable status, all that sort of thing. Think about that. That can be quite expensive. As I said, we are very, very lucky. We are under Guy's and St Thomas's. They do all of that for us. We don't have to pay them. So, yeah, we are very lucky. Think about that. and who will run it, how will you structure your team, and who has overall responsibility? Do you share it? You know, who do you go to? You need sort of a network of your structure that you can, who you can go to for certain problems, etc. But what I would say is, if you want to start an organisation or you're just starting one, you're partway through, it can be challenging, it can be time consuming, sometimes it can be frustrating, but overall it is so rewarding. It's wonderful to be part of an organisation that's supporting people. I love my job. I love being part of MPN Voice and part of the MPN community. Sorry, did I not change? Oh, I did, sorry. And it takes away from me the fact that I've got an MPN, because I'm helping people, I'm talking to them on the phone or by email, and it makes me forget that I've got it. It stops me focusing on me. So go for it. Just do it. You'll love it. Thank you very much.
So we have time for one question before coffee. Yes.
Any questions? Hang on, I can't see.
It's me. It was mostly a clarification question. Maybe I missed it. When you said you had 9 regional forums, did you mean that you had one forum each in 9 different regions over a year, or do you have? Are there like 3 different regions and they meet 3 times a year? Or
It's a forum in a region around the UK.
You had 9 different.
So it's
regions.
9 different locations. Yes.
That's great, because I was thinking when Param was talking, I mean, India is so much bigger than the UK, and to have one organization, I was thinking his next step is to follow this model, to have one in Calcutta, one in, Param. I'm talking about you.
Yes,
so, yeah.
It's easier for us to do the 9 in the UK because it's not very big. So, it doesn't take us too long to travel to them. Yeah. Any other questions, apart from John?
One thing I would just add to that, I think one of the things that has helped MPN Voice succeed over the years is the commitment of the clinician network, which obviously kind of coalesced around Claire's work. But the way the forums have generally been established is through an MPN specialist in those specific cities.
Yeah.
And they have reached out to their patients and encouraged them to come to the hospital or the hotel or wherever it is. And I would encourage people to think about using the existing doctor network in your countries as well as trying to build your own connections.
Yeah, that is very, very important. Yeah, thank you.
Thank you so much.
Okay.
Excellent. Now we'll adjourn for coffee. So thank you very much for your attention.